Hello, my dear friends. Today we are comparing ceramic veneers and composite veneers. My name is Dr. Dmitry Gorbatov. I'm practicing cosmetic and holistic dentistry for more than 34 years right here on South Ocean Drive in Hollywood, Florida. What's the difference between ceramic veneers and composite? Of course, the first difference is material. Ceramic veneers made from ceramic, composite is made from composite, plastic. The big difference is in cosmetic dentistry is, of course, the look of the restorations. So ceramic veneers are more translucent, they're more alive. So when the light hits the ceramic veneers, they look alive, they're sparkly, they create that beautiful brightness of the smile, so it looks more natural. Plastic veneers are more dull. It depends, of course, there is different types of plastic, but most of the time they're pretty dull. They got different reflection of the light than ceramic. They're not so strong. So composite veneers are not strong enough. They usually last about 6 to 7 years, and then they start to chip out and they start to have some leakage around the veneers because of the technology of composite veneers is light curing materials. So when we cure it with the light, it'll get some shrinkage. When we get some shrinkage, it got some leakage underneath. So it will take some time to get that leakage noticeable as darkness between the teeth and where the veneers is ending. But over the time, the darkness will appears between the teeth and people don't like it, of course. In ceramic veneers, we don't have these problems. If the ceramic veneers are done properly and with the right cosmetic dentist, they don't have this kind of problems. They don't have that leakage, and they will last much longer time. We're talking about 15 to 20 years. When we're using, like in my practice, when we're using composite veneers, we usually use them not really for adults, but for the kids who got some trauma, for teenagers who got some accidents done and they broke their front teeth and they have to be restored. Then we start using composites. Composite veneers, composite restorations on the front as a temporary solution, only before they become adult. So when they become adult, 24, 25, we changing those composite restorations to ceramic restorations, which of course, last longer, it looks better. But before the 24, 25, we're not really doing it. We're using composites. Most of the time, we do ceramic veneers. First of all, because they're strong, they looks very natural. They really allowed us to create, to change the shape of the tooth, the size of the tooth, the position of the tooth. It's basically 99% of the veneers we do are ceramic. So if you're planning to have some cosmetic work done in your mouth, please contact us. We'll glad to guide you to see what kind of restorations do you need, and we'll create a beautiful smile for you. So thank you very much for your attention. Have a wonderful day. Thank you.